All right, we're going to start off in the oral cavity. First, we're going to look at the lingual papillae. These are sort of the taste buds and modified taste buds. We have the filiform papillae, the foliate papillae, the fungiform papillae, and the valate papillae that we'll see. We'll also see the frenulum on the tongue, the salivary glands, the hard palate, and the soft palate, and we're also going to look at the pharynx and the different sections of the pharynx. There's the oropharynx, the laryngopharynx, and the nasopharynx. We're also going to point out the epiglottis as well as the glottis. Now, the pharynx and the glottis, I want to mention that those are air spaces, not actual structures. So just please keep that in mind as we go through the dissection. All right, so we've already broken this cat's jaw so that we can get a good look inside the oral cavity. The first things that I will point out are the salivary glands, and unfortunately I did not do a very good job of pointing this out, so here are some little arrows pointing to them. There's two little buds sort of near the frenulum of the tongue. Those are the sublingual salivary glands, and then back by the molars you can see the molar salivary gland right here. And then here's just a picture where you can see them a little more clearly since I did not do a great job. So if you remember back when we did the dissection of the neck, we had those two salivary glands in the neck. We had the sublingual salivary gland, and then we had the mandibular or the submaxillary salivary gland. We also had a lymph node back behind that, just to sort of give you a frame of reference of where everything's at to kind of jog your memory, but that's not a salivary gland, but just to show you where we're talking about here. And then inside the mouth, so number 5 right here, that's where that molar salivary gland is located, that one that we poked at behind the teeth right there. And so for the sublingual gland, you'll notice that it was out by the neck, but when we pointed to it in the mouth, it was underneath the tongue. And that's because the ducts that empty saliva into the mouth go through the jaw and come up right underneath the tongue there. So that's why we can identify it both at the neck and also underneath the tongue. So I mentioned the frenulum earlier, and all that is this band of tissue that sort of tethers the tongue to the bottom of the mouth. And then we have the lingual papillae. Lingual just means tongue, and what these are, they're taste buds or modified taste buds. Not all of them are actually used for tasting, but up here in front are the fungiform papillae, and they are smoother. And then the filiform papillae, these are the rough ones that the cats use to clean themselves. On the sides and closer to the back are the foliate papillae. These look kind of leafy. That's why it's called foliate, like foliage. And then way in the back, the very tall, and this cat is sliding away, so it's a little hard to see. I'm going to pull the cat closer. Mrs. Walker. There we go. Thank you. Way in the back are the valate papillae. So they're very tall, like hills and valleys. That's the valate papillae in the very back. So valate papillae in the very back, and then the nope, I'm going to point to it again. Just kidding. Valate papillae, and then the foliate papillae right there, and then the filiform papillae and the fungiform papillae. And then here are some pictures just to get a little better look if you didn't quite see those very well. So our hard palate right here has ridges, and the soft palate in the back is smooth and soft. If we go up underneath the soft palate, that's where we'll find the nasopharynx. So that's going to be the air space that leads up into the nasal cavity. The air space that leads down to the larynx, that's the laryngopharynx. The laryngopharynx is, again, just an air space. And then the air space in the oral cavity is the oropharynx. So those are the parts of the pharynx, the nasopharynx, and then the laryngopharynx leading to the larynx, and the oropharynx, the airspace in the mouth. And finally, we're going to find the epiglottis and the glottis. First, need to remove the musculature that's lying on top of the trachea so that we can pull that up and actually look down into it. If you did break the jaw well enough and opened the mouth really far, you could potentially look down and see the epiglottis, but we're going to find the trachea right here. It's got these rings of cartilage that give it structure to keep it nice and open for breathing. All I'm doing right here is just making a little notch to make it a little easier to see the difference between where the trachea and the esophagus is later on, so don't worry about that. You need to find the larynx, which is this cartilaginous place on the superior section of the trachea, and then cut just above that where it starts to get softer. That's going to ensure that you preserve the epiglottis when we pull this out and look down into it. So right here, that's the hole that leads into the esophagus. And then there is the glottis, and then the epiglottis is this piece of cartilage that's sort of tongue-shaped, and it will cover the glottis to keep food from getting into the larynx and down into the trachea. So the glottis is the airspace inside the larynx, and the epiglottis will cover that.